I just want to update the community in relation to the Delta strain that we reported yesterday in the update. So New South Wales Health is still continuing to investigate the source of the Delta strain. So this is a new Delta strain that's been identified through the genome sequencing. So as a routine, we do progressively do special testing on all of the isolates and we've detected a genome of the Delta strain which is different from that was previously transmitting in our community. We've linked that back to a person who returned overseas, but the exact mechanism of how that new Delta strain emerged and got into the community in Western Sydney is still under investigation. So we will update you as those investigations continue, but I just want to reassure you that there's nothing about this new Delta strain from looking at the genomics that suggests that it's any more transmissible, any more going to cause illness or any other issues additional to the current Delta strain. So in essence, it is another Delta strain circulating in the community. And we'll update you accordingly. I just want to mention about the booster doses. So just to reinforce that ATAGI, the Australian Technical Advisory Committee on Immunisation, yesterday recommended a third dose of COVID vaccine for people aged 12 and older who are severely immunocompromised. And this is due to emerging evidence that some immunocompromised individuals have not as good immune response and need that third dose to get that best chance of protection. So for the third dose, an mRNA vaccine, Moderna or Pfizer, is the preferred to AstraZeneca, and the recommended interval between that third dose is 2 and 6 months after the second. So I would urge everyone, this is updated advice, if you've got, for instance, renal dialysis, you've had a transplant, you're undergoing chemotherapy and immunocompromised, now is the time to discuss with your doctor. And if you've had your vaccine, particularly within 2 to 6 months, please reach out to your doctor and check whether you now need the booster. I should say that ATAGI is currently looking at the issue of recommendations around further booster doses, and we are expecting the guidance in relation to other areas for such things as healthcare workers, the elderly and other categories to be coming in the next couple of weeks. In terms of areas of concern, we're still seeing declines in a number of areas in southwestern Sydney and Western Sydney, but I just still urge those communities to come forward for testing. There are still high rates in a number of the suburbs, and we do want to continue to see those case numbers decline. In terms of far west, Broken Hill and Wilcannia, the case numbers are pleasingly settling, but we have seen a number of cases related to Dareton. And I want to thank the community for a great testing response in Dareton, but please continue to get tested, get vaccinated and follow the public health advice. In relation to our Hunter and New England area, we've obviously been mentioning that we've been seeing increasing cases over recent weeks in that area. Taree and Tamworth are of increasing concern, so please be very vigilant, continue to come forward for testing and, importantly, get vaccinated. And Cessnock and Lake Macquarie area, we're continuing to see case numbers reasonably high. There have also been new cases in Walgett and new cases in Cowra, so again a call out for the regional communities to be particularly vigilant and, most importantly, to come forward and get vaccinated. The access to the vaccine has increased markedly over the last couple of weeks, and so it is important that if you have a delayed vaccination appointment, please try and reschedule that earlier or look for other options. We do really want to see us get to as high as immunisation coverage as we possibly can, as quickly as we can. Thank you.